Hi, I'm Femi OK, and you're in the stream. America is making headlines by the way it is handling the global pandemic. What does it mean for brown and black people? Today we compare stories and stats and stories about racism, healthcare, and the coronavirus. You can jump in that conversation. You can weigh in on YouTube. But first, I want you to meet the guests. Nicole Hannah-Jones, welcome to the stream. Introduce yourself to our international audience.
I'm Nicole Hannah-Jones. I'm a staff writer at the New York Times Magazine covering racial inequality, and I'm the creator of the 1619 Project.
So good to have you. And Dr. Sherelle Barber, tell us who you are.
Hi, I'm Dr. Sherelle Barber. I'm a social epidemiologist and faculty member at Drexel University at the Dornsife School of Public Health in the Department of Epidemiology and Biostatistics. My research studies the links between structural racism and health inequalities in the United States and Brazil.
So good to have you. I'm not going to start with a stat. I'm actually going to start with a story about Gary Fowler. Now, his father died of COVID-19 and so did Gary, but not until he'd gone to 3 separate hospitals saying, I've got COVID-19 symptoms. They all turned him away. He died in his chair at home. Now, we know this story because his son spoke out about it.
No one tried to help him. They sent him home to die. People are being pushed home to die around their families and infect their family. Like, just mind-blowing to experience it and just crazy to witness it. She's getting better every day, but she's still just heartbroken over my father and my granddad just dying so closely together, and no one trying to help my dad at all.
Nicole, this is a story that sums up what we are talking about today, and that story caught your attention too. Tell us why.
Yes, because we know that in the United States, Black Americans are not only contracting the virus at disproportionate rates, but are dying at disproportionate rates. And in many places, numerically, Black people are accounting for the majority or all of the COVID-19 deaths, even though Black people are only 13% of the population. So when we see a story like that, which came out of Detroit, we understand that it's not just that Black people are getting the disease and suffering from the disease, but that Black people are not being treated equally when they are coming to hospitals. And there's a long history of this. We have seen it for centuries where Black people get disparate treatment throughout the healthcare system, not just at the point of getting a deadly virus.
Mm-hmm. Sherelle, there's a story that you can tell also about a woman who went into emergency, the ER of a hospital, and she was turned away as well. Tell us about that story.
Yeah, so I was actually on an interview for a Canadian radio station, and the story was that a cousin was actually telling the story of her cousin down in Atlanta who literally went to the ER 3 times. Saying she had shortness of breath, saying that she, felt like she had the symptoms and being turned away. And again, just as Nicole said, this is not new. We've seen these kinds of mistreatment, these biases, this discrimination that happens within the healthcare system time and time again. If you just look at, for example, maternal mortality, those rates in African-American women that are much higher, death rates that are much higher for African-American women, and people cite discrimination, people cite not being listened to as reasons that they are not treated the same within the healthcare system. So, I could go on and on about the stories that I've seen in the news or either personal stories about just literally people being turned away from treatment, and it's just not okay.
And Femi, I think it's important to point out that this is, a lot of people will say it's just poverty, and it's because Black people are more likely to be poor, and so poor people get lesser treatment. But these effects, we see them no matter the income or educational level of Black Americans. And so what we do know is that throughout the system, Black people are not believed when they present with symptoms. They are often not given the extra treatment that white Americans get. And this doesn't matter if you're talking about a low-income Black person or a wealthier Black person.
Ladies, I didn't want to start with the numbers because I wanted to start with real people so people could hear the pain of the stories about being turned away, not getting the treatment. But let's tackle some numbers here. I'm going to looking at Louisiana, for instance. They have a population that's 30% African American. Their COVID-19 deaths, 56%. In Michigan, 13% African Americans, 41% COVID-19 deaths. You don't need to be a statistician to actually be able to appreciate that. And you say that this is nothing new, that we have seen this before. There is a history of that. And that really speaks to Ashley Shelton. She's the founder and executive director at the Power Coalition for Equity and Justice. And she's been dealing with these figures for so long. And she says, it's not a surprise.
Here in Louisiana, we know that African Americans are dying 7-1. And I think that we have to ask our leaders to really look at the data and analysis that has existed for years, that looks at the structural and systemic racism that belies so many of the policies in our country that have trapped African Americans in a cycle of poverty and criminalization that has not allowed them to access health care, living wage jobs, unpaid sick leave, all of the things that we're seeing really important during this time.
But, Sherelle, when you look at those numbers, the ones that we have so far, what are they telling you about where we are in America today?
Yeah, so no, that's a really good point. So what I'll say is that, back in March, before the numbers even began to emerge, me and some of my colleagues wrote a piece called Racism in the Time of COVID-19, because we knew, based on history, based on the fact that Blacks already die at higher rates from every major cause of death in this country, that the COVID-19 pandemic would be no different. And so what it says to us is that we have not dealt with America's original sin, which is slavery, which Nicole Hannah-Jones so eloquently lays out in the 1619 Project. We've not dealt with that, and then that has permeated all the systems, all the structures that exist. And that shortens the lives of Black folks in this country. So not even just healthcare. We have to think about things like racial residential segregation, the legacy of redlining, which is kind of the disinvestment that has happened in these communities for decades. We have to talk about the lower wage limits to education, which leads to lower wage job, and so many of our low wage essential workers are disproportionately Black and Latino, right? So we have to talk about those issues, and they don't have the protections, right? They're being sent into their jobs without the proper personal protective equipment to keep them from being exposed. And that not only impacts them as individuals, it impacts their families and the communities they have to return to. So this is a large structural issue. They're interlocking systems of injustice and racism that we're seeing play out so starkly when we're seeing these higher death rates in Black communities.
If I could just add, I think we need to always be careful when we say things like, I'm not surprised by this. Because no, it is not shocking. But when we say that, then we just accept that this disparity will exist and must exist.
It is shocking. It is.
It should be.
Right?
When you look at Norfolk, Virginia, every single person who's died from COVID has been Black. In St. Louis, every single person who has died from COVID has been Black. That should shock all of us because, of course, what we were told was, oh, this virus is a great equalizer. It doesn't matter your race, your social class. Exactly. It affects us all the same. Well, that is demonstrably not true. Who are the people most likely to work in public-facing service sector jobs? Who are the people who have to take public transit? Who are the people who could not, like many of us, be sheltering in place? They're not sheltering in place. I've been sheltering in place for 6 weeks now because I work that type of job. These are all disproportionately Black and brown, and particularly Black and brown women. And that matters. But it's also the forced segregation in these communities, which means that Black and brown, but particularly Black people, are living in very densely segregated neighborhoods. So when someone does get this, they bring this back to a segregated community and it spreads a lot faster. But then you have the least level 1 trauma centers in Black communities. We have healthcare deserts in Black communities. So you're more likely to get sick and then less likely to have access to care.
Ladies, I'm going to go to YouTube. I'm going to go to YouTube via a thread that I want everyone to see, and that is a thread that Nicole Hannah-Jones wrote in response to everybody saying, well, COVID-19, it's the great equalizer. It can get any of us. And both of you are just explaining why it will get some people more than other people. So it is not the great equalizer. On YouTube, Vanjie A, they found another way to get rid of us, okay? Us being Black people. She says, how do we know the numbers are being recorded accurately? That is a very good point. The numbers for COVID-19 cases anywhere in the world, who knows if they're accurate? Shira, do you want to take that one?
Yeah, so one thing is we know that there's under testing because we know that we're only right now doing diagnostic testing. We're not doing widespread surveillance. So the overall numbers are being undercounted, as well as numbers in terms of that are broken down by race. So we also know that not all states, not all local communities are collecting data on race. So we have to definitely, and that's why so many folks were pushing for this data based on race, we make sure that we are able to make the invisible visible, if you will, and make know where we have these issues. But in addition to race, we also need to be thinking about smaller levels of geography. But because I think, for example, zip code communities, because this is also will tell us about the structural ways in which COVID-19 is disproportionately impacting certain communities.
Nicole, let me put this one to you. This is Turkey Neck on YouTube. Why are Blacks always feeling sorry for themselves? There was a report that Hispanics are equally as affected.
Well, one, I'm not even going to deal with the first part of that question because I think it's ridiculous. But two, Latinos we're not actually seeing data that is matching Black Americans. So in most places that we have seen racial data coming out, Black people are overrepresented in ways that Latinos aren't. Now in New York City, Latinos had about the same rates as Black Americans, but what people need to understand is in New York City, many Latinos are also Black in a way that you don't necessarily see that in other parts of the country. This isn't about Black people feeling sorry for themselves. We have data, and the data is very clear who is dying disproportionately, who is getting infected disproportionately, and to say we need to actually figure out why that is and know this so that we can send the resources to the proper communities. We know who's getting tested, and it's not the communities that are being hurt the most by this. That's not feeling sorry. That's just the facts and the reality on the ground. And the whole premise of the question is actually a little ridiculous.
Yeah, and I'll add to that, Hannah, in terms of testing. So, for example, two communities that I've heard of in recent weeks, one in St. Louis in a predominantly Black community, where the federally qualified health center literally received only 5 tests. 5 tests for the whole community, and this was from a pastor who pastors near Ferguson in Missouri. And then in the Mississippi Delta, where I also have colleagues, the Mississippi Delta, poor Black folks in the north of Jackson, again, federally qualified health center only received 5 tests. And they didn't even have a place to send them for proper processing. So when we're talking about these testing discrepancies, they're real, and they've left out so many of our communities.
We also have to ask the question, I'm sorry, if I could just,
go ahead, Nicole.
When we were talking about Italy or Spain and the high numbers of death there, no one was asking, well, why are Italians just feeling sorry for themselves? Or why are Spanish people just feeling sorry for themselves? This racialized sense of who is deserving of our sympathy and who is not speaks to why Black people are suffering at the highest rates right now. Because before we got race data, people were blameless victims who were worthy of our sympathy. And now we want to know, why are Black people complaining that they're dying? That's where we are.
Mm-hmm. Let me share this with you. This is Ama Diallo on YouTube. Hi, Ama. Thank you, everybody on YouTube, for weighing in here. Ama Diallo says, it is just a matter of racism. I want to take you to the pinned tweet on Dr. Sherelle Barber's Twitter feed, and she will just call out this pandemic as it's just racism. More eloquently than I've just done, but racism. And then, ladies, I have to share this headline with you. Surgeon General singles out people of color to stop alcohol, drugs in COVID-19 fight. So it was a sort of pep talk and a sort of lecture, knowing that more people of color were being impacted by COVID-19. Nicole, you go first. Sherelle, you comment second. Nicole.
again, it speaks to the way that in this country, our sympathies change when we believe that Black people are the face of the virus. You did not see the Surgeon General lecturing Americans about personal behaviors that had nothing to do with the virus. Whether or not you do drugs or drink has nothing to do with the virus. And by the way, data show that Black people actually use drugs at a lower rate than white Americans. But as soon as the data comes out that Black people are suffering at the highest rates, then it becomes a lecture about personal responsibility. We're no longer all in this together. It's up to these communities to stop doing things that are harmful. That is the racial legacy that we live with, and that is why you now see these protests to open up the country, right? Now that we know that it's Black people mostly dying, the question is, well, why should white Americans be suffering economically for Black death? We need to be very, very nervous about the way the conversation has changed now that we know who the people are who are dying.
Sure, go ahead.
Yeah. So just the Surgeon General's just fell into this trap of blaming the victim, if you will, and it's really unfortunate because we know again these structural issues, the systemic racism that has impacted Black communities for centuries in this country. So to shift the blame is not only not only about narrative, but it also then means that we can wash our hands of responsibility of sending the proper resources to Black communities, of making sure that those who are most vulnerable to this pandemic get what they need in order not to die. So it actually also shifts the blame. And so the federal government doesn't have to respond. State governments don't have to respond. Local governments don't have to respond. And they leave Black communities fending for themselves in the middle of a pandemic. And that's really telling of how much we see certain communities as disposable in this country.
I like that you talked about Black communities fending for themselves. It picks up on what Ms. Vital Survivor is saying on YouTube. And she says, what can Black people do to become less dependent on these systems that leave us out, like food and education, healthcare, etc.? I mean, Nicole, this is your work. This is your journalism.
Yeah, I think that's not the proper question. I mean, yes, certainly there are things that Black people can try to do, like eat healthier. But these are structural issues, and it's not to take away our agency, but it's to understand that simply saying if Black people did these things differently, we are 13% of the population in this country. We have more than twice the poverty rate of white Americans. We are, outside of Native Americans, the poorest group in this country. So to say that it's matter if we just did things differently, that's not going to make us get better health care. That's not going to make doctors treat us better when we show up. That's not going to stop us from having to take public transit. That's not going to end the Black to white wealth gap. So it has to be that we look at this as a structural issue. Because when you look at the data, it doesn't matter where you are, whether you're in the Mississippi Delta, whether you're in New York City, whether you're in Chicago, whether you're in Seattle, whether you're in Vermont, where there's hardly any Black folks, we're still suffering from this virus in the same way. That speaks to a structural problem and not a cultural problem.
Ladies, I want to tell you about Heather Watkins. She's a disability rights activist. She told us on the stream that she has health issues. So as a Black woman who's an activist and has health issues, she's incredibly nervous right now.
As a Black disabled person working in advocacy, I am hyper aware of how much Black and brown communities are being disproportionately negatively impacted, and it does add a layer of anxiety, particularly because I have compromised respiratory muscles. So I try to do my best and adhere to CDC guidelines, hope for the best, and hang in there.
But one of the things that she's doing is she is an activist. She talks about having hope. But what practical, and Nicole, I mean, this idea of structural racism, it's so much bigger than sitting down and having a conversation. But Shira, what are you seeing where you're seeing, people are taking this seriously and they're doing something? Is it the activists?
Yeah, I mean, there's so many folks who are doing things on multiple levels. So, for example, and I call it, they're showing a lot of power within in the midst of the pain, right? And we've done this. We find ways, Black folks make ways out of no ways. We do for our communities when others don't, and so it's really empowering. So, for example, in Philadelphia, where I live, in North Philadelphia, there's the North Philadelphia Peace Park, and they've set up different mechanisms for mutual aid during this time. Making sure folks have food, making sure folks have, need to get the things that they need during the pandemic. So they're doing it, and it's really powerful. We also even have, for example, the Poor People's Campaign, which is a national movement of poverty and racism interconnected, which is really calling on our legislators, right, to make the calling on the legislators to do what they need to do right by low-wage workers, to do right by Black folks, etc. They basically did an analysis of the gaps in all the legislation that has come so far that have left people out, and they're pushing people to call their legislators, call their governors, call the people in power in order to make sure that the response to this COVID-19 pandemic is equitable and just. And so I've been really honored to serve with this group as they, again, advocate for the proper response, an equitable and a just response to this pandemic, because otherwise we're going to leave whole communities behind.
I also think it's important to add that Black people are social distancing, right? Like Black people are listening to the advice of scientists and doing what is told they just had a recent poll that showed Black Americans support the stay-at-home orders at the highest rates of all groups, even though economically we are hurt the most. We have the least wealth and the least income, most likely to work in the jobs where people have been laid off. 1 out of 4 Black Americans, according to the recent poll, have lost work, and yet we are supporting social distancing and other health measures. And I also like to shout out, there's a young Black man who started a GoFundMe for rent relief and has given out more than $200,000 in $200 increments just to help people pay their bills. I've donated to that. I know thousands of Americans, and particularly Black Americans, have donated to help our fellow Americans out in this hard time. So we are working together.
I just want to remind our audience of Keith Gambrell. You may remember he was the young man who talked about his stepfather going from hospital to hospital to hospital. And he talked about that pain. He shared that story. So we know that story. And it occurred to me, Black Lives Matter. I was like, okay, that is the bigger phrase of this, that Black lives do matter. But one of the things he says in that report, and as he's been talking to people, he says to them, if you're going to hospital and you're a person of color, don't let them push you out of the door. Go back. Don't give up. Yeah. Because maybe his father would still be alive today if they hadn't gone home. Gone home 3 times. I am listening to you here, and I've been watching all of these stories. How are you not angry, furious, weeping all of the time? How do you two manage to channel that, even if that is an emotion? Sherelle, you start first.
Yeah, I mean, I am angry and sad and all of those emotions, and which is why, as a social epidemiologist, I've decided to be engaged in activism in this moment, right? So as a scholar, knowing these numbers, knowing the disproportionate impact, knowing the deaths. Again, I said we count death in epidemiology. That's what we do. And we're most concerned about those unnatural deaths, those avoidable deaths, right? And so what I've tried to do is link science with social movements in order to push the envelope forward, to push us forward to really having a just and equitable response, and to present the counter narrative in the public discourse of structural racism being the major driver of the pandemic in this time.
Nicole.
I'm motivated by rage every day, and I feel a great deal of anger and rage right now. And I just try to channel that rage into my work to make that rage. Rage can either be crippling to you, or rage can be a motivation for you. And I try to use my rage to motivate myself to continue to expose both the hypocrisy and the inequality of what we posit as the greatest, most exceptional nation in the world. but it doesn't treat all of our citizens that way.
Yeah. So
we have been having a conversation about Black and brown people in America, but the stream is an international show, and on YouTube, sort of the earth reminds us all that the same thing is occurring in the UK and in cities like Paris. It's a structural problem, including institutional racism in medical care. So our conversation, rooted in the US, it makes sense in other places around the world. Nicole Hannah-Jones, Dr. Sherelle Barber, thank you for bringing your expertise here to the stream. I wish it was under better circumstances, but it's been a pleasure listening to you. Thanks to YouTube for joining in as well. This has been an episode of The Stream, Home Edition, talking about the coronavirus and racism in the United States. See you next time. Thanks for watching, everybody.